Hello and welcome to Types of Patient Reporting. This includes handoff communication, change of shift report, and SBAR. A handoff communication occurs between two parties. It includes the transfer of a patient information that is important for care. It also includes the opportunity to ask questions, clarify, and confirm information. Change of shift report is a type of handoff communication. It can be written or face-to-face. Some facilities will do this type of reporting at the actual patient's bedside. This gives the patient and their family a chance to be a part of the report and ask questions and stay informed of their status. SBAR, which stands for Situation, Background, Assessment, and Recommendation, is nothing new. We talked about this in on-site clinical. I want you to make sure that you watch the video in Module 2 under Patient Safety Care for an example of SBAR. Another place to locate a video is in your ATI modules. Under My ATI, Learn, Nurses Touch Professional Communication, Organized Communication, Expand All, Review SBAR, and you'll find a video. SBAR was initiated by the Joint Commission. The situation stands for the patient's current status and their current status of what's actually happening to them right now. We do SBAR, by the way, when there is a change in a patient's status. So what is happening currently in the situation with the patient? Background may include the admitting diagnosis, how many days they've been admitted or been in the hospital, code status, and any pertinent medical history. Assessment represents any current and appropriate assessment findings that may relate to the patient, that will relate to the change in patient status. The recommendation is based on the assessment findings, and it's what a nurse feels that a provider should be doing or ordering for their patient. For example, maybe the patient has a new onset of pain, and that's the situation. Background is they had an appendectomy a day ago, and now they're starting to have pain. Assessment would be their current pain rating using the numeric scale and where the pain is located, what is the description and the quality of the pain, does it radiate? And the recommendation may be for a pain medication to be ordered as needed for that patient. SBAR should take place between a nurse and a healthcare provider when there has been a change in the patient's status, as I mentioned. Make sure you identify yourself and your role and what your patient's name is. Have your facts collected before you contact the provider. Very important to be organized. You do not want to have to call a provider back unnecessarily. Be prepared with the information. Please make sure you know how to do an SBAR and stay current with the process. Think about why an SBAR is so important. Aren't we trying to promote patient outcomes by doing so? Remember that if you receive a new verbal order or any type of diagnostic findings for your patient, make sure that you communicate clearly and repeat these orders back. Make them stay on the phone until this is done.